Welcome to the Nursing Dose with your host, Farah. Thank you for joining. I decided to do this pop up live to talk about a film that was recently premiered at the Howard Theater in DC, Washington, DC. And I wanted to really talk about what the movie is, why it's so important, who was in it, because I'm sure that all over social media, a lot of nurses have been seeing, and other people as well, have been seeing a lot of different posts about the film entitled Everybody's Work Healing What Hurts Us All. Okay, so I want to just kind of go into the movie, the experience, and really the impact and what you can do to take action to move towards health justice. Okay, so really to start off, for those who don't know me, my name is Farah, Dr. Laurent, aka nurse career coach. Been a nurse for over 20 years. My experience stems really working in the emergency department in Canada and in the United States, where I worked in multiple cities. I've seen so many different things in terms of health inequalities, health disparities, and really took a role of advocacy as a staff nurse in the ER, and then became an educator. Then later had some leadership positions, and then was adjunct faculty for NYU. So the reason I want to talk about this movie is because personally, in my own nursing journey, as a nursing student even, I definitely experienced some discrimination through nursing school. There wasn't a diverse faculty in academia for nursing school where I was in Canada. And I know that that's kind of changing a little bit now in different schools. So that's definitely something that I want to touch upon. But really, everybody's work. This movie was created by, in collaboration with, I believe, Beth Toner from Robert Wood Johnson Foundation and Chad um, Tingle, I believe. I don't want to say it right. He was the direct. I say it wrong. He was the director of the film, and then many different nursing leaders were in the actual film talking about their own lived experiences as nurses and as nurse leaders, both in academia and in the clinical setting. So, again, I just wanted to just start off by saying that this is my own kind of personal view of the movie, my own opinion, and it has nothing to do with any affiliations, previous employers, or future employers. These are just my own thoughts and opinions when it comes to this particular film, which is, like I said, a documentary really highlighting structural racism, discrimination in healthcare from a nursing perspective, kind of looking both from uh, a provider as a healthcare provider, as a nurse giving and delivering care, or just even teaching in different institutions or part of different professional organizations, and then from the standpoint of patients, um, what patients are even experiencing today. And it's not even just what hurts us all, right? It's beyond what hurts us, because patients are actually dying, particularly as we all see on the news and from different reports, uh, maternal child, that, the issue of non-white women are 3 to 4 times more likely to die of a pregnancy related issue or during childbirth. And that is insane, right? Living in a country like the United States. Again, like I said, I also worked in Canada. There were also issues there. And again, no healthcare system is perfect. However, we really have to bring awareness to these issues and really talk about how we could take action to improve things and to really reflect on everybody's own personal biases. So, this is what the movie does. It really takes you through a journey. So, the premiere, like I said, was in Washington, D.C. I had the pleasure of going in person and actually viewing the film for the first time at the Howard Theater. So historical, There's so many different people in the movie. And again, shout out to Dr. Katie Boston Leary for the invite. I really appreciate it. It was just such a blessing and honor to be in presence of so many great nursing giants and leaders and activists. Dr. Katie Boston Leary was in the film, Dr. Kenya Beard, um, Dr. Jan Murray Garcia, Peggy Chin, Taloa Sharp, Ernest Grant, who was the former ANA president, Tanja Copeland, Aaron King, Nicole Vance, Rebecca O'Connor, Dr. Anna Maria Valdez, Lucinda Canty, Sonia Frazier, Monica McLemore, and Teresa Pack. And if I missed any doctors or doctorates, I apologize because some had it in the on the website and some didn't. But I just wanted to give a shout out to those who were in the film. Also, Kim. There were some others as well that were in the film. So if I missed anybody, thank you again for your contribution to the film. And if you guys are watching, let me know if you can see me and hear me. I know I kind of just came on last minute, but I just want to double check and make sure that I'm on. And let me know if you're watching. Say hello. Let me know what country, what city you're watching from. Any comments, questions that you may have about the film. Later, I will drop the website down in the comments. Literally, if you just type in everybody's work, shift nursing, you'll be taken to the website, but I'll drop the actual website down low so you guys can have it. So I'm not going to, take 30 minutes of your time, but I just wanted to come on and really explain what this film is. And again, it's really highlighting different experiences, even the nursing student experience. So there were some nursing students that were able to talk about their experiences as a nursing student. As I shared before, my experience wasn't probably, the greatest. And I know a lot of different people share different experiences in nursing school. Also, as a new graduate nurse, I did experience some discrimination and racism actually through certain patients calling me a colored nurse and that they didn't want me to provide care to them. They wanted a different nurse. So I experienced that quite a bit. And also some colleagues that I know, both PAs, RNs, and physicians, experienced the same thing, even in New York City, which was very interesting because you would think that in New York, such a diverse population, you think that it's a little bit more forward thinking. But even then, I did experience that. Also, even through other colleagues. So for those nurses that are watching, I don't know if you guys experienced this, but there was one particular experience where I actually was a travel nurse. I was new to a facility. I'm not going to say which facility, but it was in New York. And my first day, I was actually at the computer in scrubs, the same colored scrubs that the nurses wore, and was typing on the computer. I was charting in the emergency department. And one of the nurses kind of looked back at me, didn't even introduce herself, didn't say hello, didn't welcome me. She just turned around, looked at me and said, "Can you take my patient to CAT scan now?" And I was like, I don't know who she's talking to. She's probably not talking to me. So I just kept typing. And then she said it again. She's like, "Hey, listen, I need you to take my patient to CAT scan now." So I just didn't even answer her. And then the clerk, the clerk, I think she was either registration or one of the administrative clerks she said, "Hey, listen, she's not a transporter or she's not, a CNA. She's a registered nurse." And again, the nurse just turned her head and just like didn't even acknowledge me. So these were the kind of microaggressions and different experiences that happened to me while I was working in New York. So that was pretty eye-opening. And I can't imagine working in certain rural areas where it's not that diverse. So again, that's part of my experience. And this is why this film was so impactful and so powerful. It actually brought me to tears because it reminded me of certain things that happened to some patients where I actually had to really advocate for them to get the care that they needed. So, I know it's not an easy topic to talk about, but it's the truth, right? And this is why I wanted to bring this up and talk about this film. And again, if you want to join, as the website says, join the fearless nurses across the country fighting for health justice. These are two things that you could do. Number one, you can host a screening and amplify the conversation of health justice and the health justice movement. So you can go to the website. When I drop the link, you'll see it. And you can request to host a screening for your organization or wherever you work. So you can have obviously more awareness to this. And then another way is that you can raise your voice by endorsing the film and sharing it and talking to other people about it so that it could really be spread globally. And again, it doesn't have to be just in your workplace where, let's say, in a hospital, it could be anywhere in academia, any professional organization, just to really host a screening and really endorse the film and talk to other people about it. And again, the name of the film is Everybody's Work, What Hurts Us, Healing What Hurts Us All. And I hope to hopefully have some members who were in the film, like Kim, Taloa Sharp from Oklahoma. When I have a chance, I want to invite Tanja Copeland, all these people to hopefully be on the nursing dose. Maybe I can have a couple of them at a time, if time permits, like to be all on, to share their experience making the movie and their own shared lived experiences. So let me know if you guys have heard of this film. And again, it just premiered on, I believe it was May 10th was that Friday. Yes, it premiered on May 10th in Washington, D.C. at the Howard Theater. And let me know if you heard about the movie. Let me know what your thoughts are. And let me know if you want to host a screening. Put host a screening if you're watching the replay. Put host a screening or endorse this film. And like I said, I'll share the specific information of how you can apply to get the screening where you are, your organization. And I encourage you to go to the website and learn more about this film and what you can do to kind of spread awareness around this health justice movement and bringing awareness to racism in healthcare and what you can do to kind of amplify your voice and other nurses' voice. And even if you're not a nurse, you don't have to be a nurse to request a screening, right? You could be another healthcare professional or, a non-healthcare professional, because I think it's important that everybody sees this film. You don't necessarily have to be a healthcare professional or a nurse to be able to host a screening. So I think definitely go to the website and check it out. And I encourage you to reach out to the people who were in the film. Again, people like Dr. Katie Boston Leary, Dr. Kenya Bard, Dr. Mary Garcia, Peggy Chin, Taloa Sharp, Dr. Ernest Grant, Tanja Copeland, Aaron King, Nicole Vance, Rebecca O'Connor, Dr. Anna Maria Valdez, Lucinda Canty, Sonia Frazier, Monica Macklemore, Teresa Park, and Kim, right? So there's so many different people. Definitely reach out to them, ask them what their experience was, how you can maybe collaborate with them, on this particular movement. And then obviously the website has Shift Nursing, and you can go on there and see what else that you can do. So that's pretty kind of much my message that I wanted to share with everybody. And really explain about this film, because I know a lot of people are probably asking questions like, what is this film? What is it about? And I think it was beautifully done because it incorporated like I said, nursing students' perspective, uh, nurse leaders, nurses in academia, nurses from nursing organizations. So you had a little bit of different perspectives, and also talked about a little bit of the history of nursing, which is interesting because nurses face a lot of adversities. Non-white nurses weren't allowed to practice in certain settings until much later, and they weren't allowed to join certain organizations. And that's where the National Black Nurses Association was formed, which is a great organization. And I encourage you to definitely look into it and join as a member. They have their national conference that's going to be in San Francisco at the end of July. Again, it's the National Black Nurses Association. Um, and if you happen to be Canadian and you're watching this, you can definitely also go to the website and see if this is something that they would be able to screen in Canada. I should have asked that. I didn't ask that when I was there, but I'm sure they can make it happen. And if you don't know about the Canadian Black Nurses Alliance, definitely check them out. Shout out to Ovi, who's the president and founder. I'm also a mentor for the Canadian Black Nurses Alliance. If you want to be a mentor, definitely check out their mentorship program. Also, there's the RNAO, Black Nurses Leading Change. You can join that organization as well. There are so many great organizations out there. There's DMPs of color. So this is not just for nurses who have their doctorates in nursing practice. You can be a student. You don't have to be in the doctoral field. You can be a nursing student, undergrad or master's level, whatever it is, and you can still join DMPs of color. And that's led by the founder and president is Dr. Danielle McCamey. Shout out to her. I met her when I was in DC. She's amazing. And then another great organization, which I'm a part of too, the DMPs of color. I'm a part of the Black Nurses Collaborative, which is led by Meaty Bardinelli, awesome individual, also from the DC area. And the Black Nurse Collaborative obviously is all about collaboration with nurses and doing many different things to uplift the profession and other nurses within the organization. So definitely connect with Meaty Bardinelli. I'll drop her information. Definitely check out Dr. Danielle McCamey from Johns Hopkins for the DMPs of color. And again, I thank Dr. Katie Boston Leary for giving me the opportunity to be at the premiere. It was such a historical moment. I got to meet so many great people, like Dr. Georges, if I'm saying it correctly, retired professor, really amazing. She actually agreed to be my mentor as well. I was like, hey, I need some mentors. So definitely made some good connections there. And I encourage you to join professional organizations. The other one, obviously, is the National Association of Hispanic Nurses. So shout out to, is it Adriana? I can't remember her last name. Yes, I think it's Adriana. She's the president of NAN. Also, let me just make sure. Adriana Nava, yes. And Kim, obviously. I met just Sanya, who's part of the, I believe, DC chapter. Kim is part of the, I believe it's Connecticut chapter. And then there's Dr. Tina Luarte Rodriguez. She was amazing to meet as well, part of the Connecticut chapter of NAN, which is the Hispanic Association. I think they're having their conference in Atlanta. And I also got to meet Madeline. I can't remember last names very well right now. Feliciano Weiser. So she does a lot of work in the DEI space. And of course, got to meet officially Dr. Sheldon Fields, who is the president of the National Black Nurses Association. So many, different leaders. Vivian Pierce, I believe is the last name. She was amazing. So, so many different people that I can't even remember the list, but definitely check out the movie. I will drop the link to go to the website to learn more about the movie and how you can host a screening and how you can endorse this film. And let me know if this was helpful to you and if it cleared up a little bit about the film, because I know I've been posting my photos and my videos about the film. And just that event was so historic, and I was so blessed and excited just to be there. Just such a great, I was like, I cannot miss this. So definitely thank you for watching. Let me know if this was helpful. And again, the Nursing Dose you can find on YouTube. Please subscribe to the Nursing Dose YouTube channel. And then you can also find this on Spotify, the audio version on Spotify, The Nursing Dose with Farah, which is my podcast. Follow me on LinkedIn. If you're not connected, please connect with me. And then also connect with all these wonderful people that I mentioned. I will try to also put their names in the comments. So if you want to connect with them, that you can. What else am I missing? I think that's really pretty much it. But again, this is an opportunity to use this film as a conversation starter, to bring awareness to health justice, and to really do the work, and even just having a screening at your institution, organization, will be very impactful and powerful, and hopefully bring some change, much needed change, to this health justice movement. And again, my name is Farah. I'm the proud founder of Farah Laurent International Nurse Coach. I'm a nurse career coach for nurses. So if you want to connect with me, learn more about what I do, definitely send me a message. I appreciate your time. Thank you for watching the Nursing Dose. Check out everybody's work by Shift Nursing and the director, Chad Tingle. And then Desiree, she was also part of the film. A lot of different people, Beth Toner, all these wonderful people. Again, thank you for watching. I appreciate your time and attention. Have a great one. Until next time, take care. Bye.